Any family can find themselves in either long-term or temporary situation where they just don't have the resources that they need to feed their families.
So, oh yeah, I have to roll to start, but it's like a $250 part plus the time to get it fixed. So I can leave it running while we DoorDash as long as I have my partner with me, but it is what it is. I'm hoping to get it fixed soon, but we had to just get our water turned back on and stuff like that. So where I live is technically a food desert. A food desert is anything that a grocery store is further than 1 mile and not easy to get to. Family Dollar on Prospect and 75th Street, the closest place to buy food for this area down of 71 Highway.
Your bread section is pretty well picked over, so the cheapest thing that you're going to be able to get is the $1.35, but delivery day is Wednesday, so that's the only reason there's bread on the shelf. Anything else is going to be $3.25, $2.25.
This is 2 miles, 2.5 miles. To get here, you're going to have to either have a car or a bus with no kids. $1.25 for the same product that was at Family Dollar for $3.25. And you have, say, $300 of food stamps. You're only going to get $100 worth of food if you rely on going to Family Dollar or the gas station and stuff like that versus being able to get to a grocery store.
SNAP really is the first defense against hunger and food insecurity in the United States. During COVID, we saw a lot of new people seeking assistance.
It seems pretty simple. It actually isn't too hard of the paperwork to fill out. Biggest problem is stuff gets mailed out, and so a lot of times people don't even get the paperwork until the deadline. I had a client who called. They told them it was a 3-hour wait, and they ended up waiting like 5 hours. That's like an entire workday. The majority of people on food stamps have been working. So it's been the working disabled and children. So you're seeing like these people who are working, who need it, who can't get it because they are so busy with the rest of their lives.
And I got a raise of 25 cents an hour. So it took me up to like $10.50 or $10.75 total. And they determined that was too much of a raise. And they took away all of our food stamps because we made over the income limit. And a 50-cent raise over a month is not going to justify losing $400 or whatever of food stamps.
I'm still on benefits. I've been on benefits since my son was born. He's 6, going on 7. I've had a lot of jobs that I've had to quit just so that I could receive the benefits.
You're made to feel like you're not poor enough or you're not in need enough or that you should feel guilty. But then you're also restricted from genuinely succeeding and improving your life because you have to cap everything or you're going to lose your food. I wish people would understand that if, you start in poverty, sure, there's like the random, hey, I made it story. But the reality is, especially like with us, with a disabled child, we're probably never going to be out of poverty. Like it just isn't, it's not set up that way because even to keep his disability assistance, we have to keep our income low enough.
Some people work really hard all day, every day, and they still have food insecurities and they still can't provide, something simple as food.
We go through a lot of the microwave macaroni and cheese bowls. Store brand's going to be almost $4.
And then once they have foods available to them, what is available to them? Are they healthy? We all know that we probably should eat more fruits and vegetables and be more physically active. But what are those barriers that are in front of us that cause us not to be able to do that?
Unhealthy processed food is oftentimes more accessible and cheaper and more affordable than the healthier foods that we're trying to give our patients. It runs in parallel with obesity. They will also then be more at risk for diabetes, for hypertension, further down the line, heart attacks, strokes, things of that nature. So you end up being stuck in this perpetuating cycle then. You find yourself treating people only to send them back to the conditions that made them sick in the first place. Very rarely does food insecurity run solo. It's often a number of other social determinants that kind of run together. They would also have employment issues. They would also have housing insecurity as well. Unless those things were addressed, we wouldn't really be able to help them reach their health goals. And interestingly so, it's children more than adults that tend to be more food insecure. So if we're truly trying to be patient-centered, then really working with them and trying to make sure that not only do they have access to food, but have access to healthy food as well, as we're trying to get them connected to resources.
Up to 52% of produce grown in our country never reaches a human consumer. What industry allows more than half of its product to go to waste? If something gets graded out at the retail level, say a truck full of corn arrives at Walmart and Walmart rejects that truck for any reason, it could be that a truckload could have 10% waste. But that means 90% of that food is perfectly good to eat, and it's going to go to the landfill. That's the kind of obscene waste you see in our country. That's a major component of the work of After the Harvest. We rescued about 501,000 pounds of fresh produce through our gleaning program last year, and we are going to see 1 million pounds this year. We work with agencies, pantries, food banks. We work almost exclusively with Harvesters, which is the community food bank in this region, because they have the best distribution methods in our region.
This year, we're on track to rescue 350,000 pounds of food. Our goal for next year is 500,000 pounds. We use about 40% of the food that we rescue here at Kansas City Community Kitchen. It's not enough just to feed people. You have to nourish them. Every meal that we serve is nutritionally balanced. It's made from scratch. It's served hot.
Peanut pepper?
Oh, no.
Okay.
The other 60% we're sharing with about 6 other neighborhood pantries throughout the city. There's food available. We just need to get it from where it is to where people need it.